Thank you, Madam Speaker. And I first just want to say thank you to Representative Mello for hearing our questions and entertaining the amendments as well. And I know that you understand the issue. We just have a disagreement on the approach, right? And so in the short period of time I have, I just want to emphasize how important CNAs are to our nursing homes and to our residents and to Floridians. And folks might not clearly understand what a CNA is or what they do. And so I just want to remind folks that we're talking about a wide range of essential services and basic needs for residents in nursing home facilities. That includes eating, bathing, grooming, mobility, and more. When I met with the CNAs in my office, we talked about how they work to make sure folks get to their appointments on time. So they really do play such an essential and important role, and unfortunately have been underpaid and overworked for years. And as I was doing research for today's debate, was looking at some of the schools that help train CNAs and seeing some of the pros and cons of the field. And so I just want to stress, what were some of those cons that are shared among the workforce? Low wages. In 2020, CNAs earned a median wage of about $30,000, which is far below the median wage of other types of health practitioners. Physicality, there's a lot of heavy lifting in this job. You potentially have your hair pulled and bruises and things like that. It's very demanding. You're working in the face of so many different unique challenges with your patients, but also, of course, different climates like COVID-19. And scheduling difficulties, working many long nights, working weekends. So this is a really important job that isn't easy to do. And I am concerned that if we change the amount of time, again, from 2.5 to 2.0, that we really are just adding more work to the plates of CNAs who already do so much. And that's not going to attract more people to the field. I don't think it makes good economic sense. I'm very concerned about quality of care for patients, because at the end of the day, the one of the pros of being a CNA, one of the amazing parts of being a CNA is that you really get to know your patients. You know what their conditions are, what their challenges are, the favorite color, the favorite meal, and that type of quality of care can only be delivered by someone who's there constantly, like our CNAs. So I really do encourage folks to vote down on this, and let's be seniors first with this bill and not allow it to pass. Thank you, Madam Speaker.